Hi, and welcome to our telehealth video information series. I'm Garvin, and this video is on Nozinan. So what is Nozinan used for? It's used for schizophrenia and nausea and vomiting in terminal illness, and also for the relief of severe pain and accompanying anxiety, restlessness and distress in people with terminal illness. So how does it work? Nozinan tablets and injection contain the active ingredient levomepromazine, which is a type of a medicine known as a phenothiazine antipsychotic. It is used in the treatment of schizophrenia, but also has uses in the management of pain, distress, nausea and vomiting associated with terminal illness. When used in schizophrenia, Nozinan is sometimes described as a neuroleptic or a major tranquilizer, though this term is fairly misleading, as this type of medicine is not just a tranquilizer, and any tranquilizing effect is not as important as the main way it works in psychiatric illness. Nozinan works by blocking a variety of receptors in the brain, particularly dopamine receptors. Dopamine is a natural compound called a neurotransmitter and is involved in transmitting messages between brain cells. Dopamine is a neurotransmitter known to be involved in regulating mood and behavior, amongst other things. Psychotic illness, and particularly schizophrenia, is considered to be caused by overactivity of dopamine in the brain. Nozinan blocks the receptors that dopamine acts on, and this prevents the overactivity of dopamine in the brain. This helps control psychotic illness. Nozinan improves disturbed thoughts, feelings and behavior in schizophrenia. It produces a calming effect and controls aggression, delusions and hallucinations. The calming and sedative effects are used to help relieve severe pain and associated restlessness, anxiety or distress in people who are terminally ill, for example with cancer. This medicine is usually used in conjunction with opioid painkillers such as morphine when other measures have not been effective. Nozinan also affects dopamine receptors in an area of the brain that controls nausea and vomiting. So vomiting is controlled by an area of the brain called the vomiting center. The vomiting center is responsible for causing feelings of sickness or nausea and for the vomiting reflex. It is activated when it receives nerve messages from another area of the brain called the chemoreceptor trigger zone, and when it receives nerve messages from the gut. Nozinan controls nausea and vomiting by blocking dopamine receptors in that CTZ zone. This stops the CTZ from sending the messages to the vomiting center that would otherwise cause nausea and vomiting. Nozinan is sometimes used to provide relief from nausea and vomiting in terminal illness, usually when other available medicines have been unsuccessful. So how do you take Nozinan? Nozinan tablets can be taken either with or without food. The dose of the medicine that is prescribed and how often it needs to be taken depends on the condition being treated. It is important to follow the instructions given by a doctor. These will be printed on the label. If you forget to take a dose, take it as soon as you remember. If it is nearly time for your next dose, then leave out the missed dose. Don't take a double dose to make up for an earlier missed dose. If you have been taking high doses of this medicine for a long time, for example to treat schizophrenia, you should not suddenly stop taking this medicine unless your doctor tells you to, even if you feel better and think you don't need to take it anymore. This is because the medicine controls the symptoms of the illness but doesn't actually cure it. So this means that if you stop suddenly treatment, your symptoms could come back. Stopping the medicine suddenly may also cause withdrawal symptoms such as nausea, vomiting, difficulty sleeping or tremor. When long-term treatment with this medicine is stopped, it should be done gradually, following the instructions given by your doctor. It should be used with caution in elderly people, people with decreased kidney function and decreased liver function, people with heart disease, and also for people with a personal or family history of a type of abnormal heart rhythm seen on a monitoring trace DCG as a prolonged QT interval. Also caution in elderly people with dementia and people with risk factors for having a stroke, people with other risk factors for getting a blood clot, people with epilepsy, people with diabetes and Parkinson's disease, people who are not eating properly or are dehydrated. So regarding pregnancy and breastfeeding, the safety of this medicine during pregnancy has not been established. It should not be used in pregnancy, particularly in the first and third trimester, unless considered essential by a doctor. If the medicine is used during the third trimester, it could cause side effects or withdrawal symptoms in the baby after birth, and the baby may need extra monitoring because of this. So it is not known if Nozinan passes into breast milk. It is recommended that women who need treatment with this medicine should not breastfeed. And next, a label warning would be this medicine may cause drowsiness. So if affected, do not drive or operate machinery, and also avoid alcoholic drinks. So the side effects of Nozinan: sleepiness, weakness or loss of strength, dry mouth, a drop in blood pressure that occurs when going from lying down to sitting or standing, which results in dizziness and lightheadedness, constipation, skin rashes, increased sensitivity of the skin to UV light, abnormal movements of the hands, legs, face, neck and tongue, and extrapyramidal effects. So these Parkinson's-like side effects are more likely to happen in people who are taking high doses for long periods of time. And also interference with the body's temperature regulation. This is more common in elderly people and may cause heat stroke in very hot weather or hypothermia in very cold weather. Also side effects would be increased blood glucose levels, decrease in number of blood cells in the blood, jaundice, abnormal heartbeats or arrhythmias, rhythmical involuntary movement of the tongue, face, mouth and jaw, which may sometimes be accompanied by involuntary movements of the arms and legs. High temperature combined with falling levels of consciousness, paleness, sweating and a fast heartbeat, and requires stopping this medicine and immediate medical treatment if that happens. So the side effects I've mentioned may not include all the side effects reported by the manufacturer. For more information on other risks and side effects, you need to read the patient information leaflet that comes with the medicine or speak to your doctor or pharmacist for more. How can this medicine affect other medicines? So it is important to tell your doctor or pharmacist what medicines you are already taking, including those bought without a prescription, before you start treatment with Nozinan. Similarly, check with your doctor or pharmacist before taking any new medicine while taking this one to make sure the combination is safe. There may be an increased risk of drowsiness and sedation if Nozinan is used with any of the following medicines, which can also cause drowsiness. So they'd be alcohol, barbiturates, phenobarbital, benzodiazepines such as diazepam, the monoamine oxidase inhibitors such as phenothiazine, and sedating antihistamines such as Piriton, and hydroxyzine sleeping tablets such as Zimovane, strong opioid painkillers such as morphine, codeine, and the tricyclic antidepressants such as amitriptyline. There may be an increase in side effects such as dry mouth, constipation or heart or heat stroke in hot and humid conditions if Nozinan is used with other medicines that have anticholinergic effects, including the anticholinergic medicines for Parkinson's symptoms such as procyclidine, antihistamines such as Piriton, other antipsychotic medicines, other anti-sickness medicines such as promethazine and cyclizine, the antispasmodic medicines such as hyoscine, monoamine oxidase inhibitors such as phenothiazine, and oxybutynin, and baclofen, the tricyclic antidepressants such as amitriptyline. And Nozinan may enhance the blood pressure lowering effects of medicines that lower blood pressure, including medicines used to treat high blood pressure, antihypertensives, and medicines that lower blood pressure as a side effect. So, for example, the benzodiazepines. If you're taking medicines that lower blood pressure, you should tell your doctor if you feel dizzy or faint after starting treatment with Nozinan, as your dose may need to be adjusted. There may be an increased risk of a drop in the number of white blood cells in the blood if Nozinan is taken in combination with other medicines that can have this side effect, such as the anti-cancer chemotherapy medicines, carbamazepine, cotrimoxazole, the penicillamine, phenylbutazone, sulfonides, the levomepromazine may oppose the effect of anticonvulsant medicines used to treat epilepsy. And the levomepromazine, which is Nozinan, may increase blood sugar levels and disturb the control of diabetes. People with diabetes may need to adjust their dose of antidiabetic medicines. And Nozinan may oppose the effects of dopamine agonists used to treat Parkinson's disease, such as levodopa. And Nozinan may oppose the effects of histamine, which is used to treat leukemia and is not recommended for people having this treatment. Nozinan is not recommended for people receiving treatment with desferrioxamine. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through my website, mytelehealth.info, or call into Lynch's Pharmacy, Douglas, Cork, or ring 021 436 66923 to find out more. Thank you for watching. Stay healthy and stay informed.